Hi, this is Emily Baker, and I'm starting to do my week 3 discussion 2 posting. Um, sorry. Power is seen as a possession of control, authority, or influence over others. This is how just the plain old dictionary kind of talks about power. Power can be used in organizations as to help reach its goal and objectives, as seen in Freight's 2014. This book goes into different powers and the definitions of them, which I will now state. Coercive power is between the driving agent and the recipients. This kind of power can actually be dependent on fear. This type of power at times can actually be seen as a threat, but it can get the point across. I currently work in a hospital setting in which I had to join a union. Just recently, my facility at the start of the flu season said if you don't get a flu shot, you will be terminated. This was when my union stepped in and stopped that. Majority of the staff did get flu shots, but there were some staff that either don't believe them or have the allergy and such, where they could not get that. But in the initial window of placing this into place, the facility was able to get a very high percentages of the workers getting the flu shot. There also is legitimate power. It's seen as authority with social and cultural norms brought forth. As being a military wife for the last 18 years, legitimate power is seen often with the work my husband does and even into the military hospitals themselves. The culture of the military is the higher the rank, and especially if you're a male, the more it entitles you to have the power and to be right with any kind of decisions that you do make. And that your decisions should not be second guessed if you are a higher rank, and especially a male, like I said. Referent power is correlating the person's charisma and how the recipients of the information sees that person. This can be confused with other powers, but the main difference is the recipient is doing said task due for an overall respect of the one in charge. They are not being asked to do the task being scared, but performing the task due to respect they have. In my profession, being a wound and ostomy nurse, I have many surgeons that I work with. There are surgeons that may not have the best intent of certain patients, like the ones I have talked about in previous discussions of like the Affordable Care Act or the homeless population or those just with no insurances. Sometimes they do not want to do the best of goals, so their power over me is having me stop something that might heal. But then there are other physicians that I work with that have the same goal that I do, that I want to heal people and I want to make them better, and that they work with me in teaching this. Expert powers are perception of knowledge possessed by the driving agent. This goes into education one has to obtain the field of work, as in to say from just like a family doctor taking care of you to an internal medication doctor taking care of you. This is one reason why the medical field has so many certifications or specialties, as in if a family medical doctor was taking care of you and you had a really bad case of diabetes, you couldn't get your things controlled, your sugars controlled, the insulin or the PO medications were not working. This gives the family practice doctor the power to refer you to a specialty doctor as an endocrinologist, who hopefully would be able to get your diabetes under control and manage it better. Then there is just plain old reward power. It gives you an incentive for being on the receiving end of the behavior. Like as the book and Freight started to talk about how maybe a doctor said, if this happens, then maybe I can talk to you with more respect or something like that. It doesn't really include giving bonuses or trips or anything like they said in Freight's. In Freight's Table 6.1, the Metzenberg power game was developed by Henry Metzenberg. This is a model or organizational behavior where the players try to control the organization with decisions and actions. Some of the positive power sources from this list could include the alliance building. I see this where the department heads form coalitions and establish norms for mutual support and cooperation. This just makes it straightforward for the workers, helping them streamline their care. With strategic candidates, individuals that advocate for specific person for a job was just experienced in my clinic itself over the last 6 months. Our provider we had left and resigned and moved on to a different kind of a field, and they were just advertising for any kind of manager to come in to manage us. Again, I'm a wound and ostomy nurse, so there's not very many people that won't even know about us and to even know what we do or what kind of special education we had to go through to obtain our credentials. We had a provider that was in our clinic that wanted this position, and we advocated for her to gain the position. So as a team, we advocated for her, and we wanted to promote her in our own wound clinic. With her already knowing the clinic and what wound and ostomy care were about, they were able to place her in this key role, thus already in the last 6 months saving money, as in the budget, getting patient and physician satisfaction. So thank you, and I hope you enjoyed or learned maybe a little bit. If there's any questions or concerns, I'm looking forward to answering them. Thank you.